An imbalance arises from a situation when the energy expenditure in the human body is less than the energy consumed, leading to a slow and gradual gain of weight in individuals. Weight gain at times is ignored by people who are habituated or obsessed with their diets, and they do not realize how their dietary patterns continue to impact their metabolic system and reduce their ability to withstand stress. Weight gain not only challenges immunity, but also increases the risk of various chronic disease conditions, including diabetes and heart failure. Obesity or overweight is an ever evolving problem that not only impacts the overall personality and confidence of people, but also challenges their workplace productivity. Understanding the causes of overweight or obesity is the key to customizing its management with the best healthcare approaches. Overweight may occur due to a variety of environmental, behavioral, and genetic factors, and at times it's difficult to understand or analyze the exact causes of weight gain, which increasingly challenges its personalized treatments. As a matter of fact, no single strategy can promise you to promptly shed your extra pounds and make you slim and trim, or at least normalize your body mass index. And that is why a comprehensive assessment of your body's physiology, health risk factors, genetic causes, past medical history, treatment history, environment, and other similar factors is highly necessary to customize your weight management procedures. Here in this video, I'm going to discuss the weight management potential of cayenne pepper based on its ability to normalize the energy cycle and dissolve extra fat in the human body. The use and dosage of cayenne pepper should be calculated as per your body's requirements, which you should try to determine with the help of your doctor. Cayenne pepper or chili pepper or capsicum annuum is used as a flavoring agent in many dishes. It has a bright red color and a spicy taste that comes from a chemical known as capsaicin. Cayenne pepper is used as a spice in many cuisines, especially in Southeastern American, Mexican, and Asian dishes. It is also used as a natural remedy for various health conditions such as pain, inflammation, colds, and digestive problems. Recently, cayenne pepper has gained popularity as a weight loss herb because of its fat burning, appetite suppression, and metabolism enhancing properties. Findings from several studies indicates the possible benefits of cayenne pepper in a range of debilitating disease conditions, including atherosclerosis, diabetic vasculopathy, stroke, angina, hypertension, metabolic syndrome, cardiac hypertrophy, fatty liver, diabetes, obesity, and gastric ulceration. Capsaicin activates TRPV1 receptors in the digestive tract. These receptors send a signal to the brain via the vagus nerve. The brain then activates sympathetic neurons that are selective for brown fat. This selective activation of brown fat helps to increase its metabolic activity without increasing the heart rate. Studies have shown that capsaicin can modestly increase energy expenditure, boost fat oxidation, and reduce appetite. These effects are all conducive to weight loss. In addition to its weight loss benefits, capsaicin has also been shown to have other health benefits such as reducing pain and inflammation. Capsaicin is an active ingredient in chili peppers and has anti-inflammatory effects emphasized in several preclinical studies. It suppresses the production of pro-inflammatory cytokines such as IL-6, TNF-alpha, MCP1, and COX-2, and increases the production of anti-inflammatory adipocytokine adenopectin. It also decreases the infiltration of macrophages into adipose tissue. These effects may be due to the enhanced activity of PPAR gamma, which is a transportation factor that regulates genes involved in metabolism and inflammation. A preclinical study has shown that dietary capsaicin has also beneficial metabolic effects in genetically diabetic mice. It reduces plasma levels of glucose, insulin, and triglycerides, and increases plasma levels of adenopectin as well. Most recent studies with topically applied or dietary capsaicin in fat-fed mice confirmed that adipose expression of PPAR gamma was increased in the treated mice. They also showed that capsaicin treatment blunted weight gain and visceral fat mass. One of these studies reported that capsaicin treatment also boosted visceral adipose expression of hormone-sensitive lipase and of connexin. Hormone-sensitive lipase is an enzyme that breaks down fat, and connexin is a protein that allows cells to communicate with each other. This suggests that capsaicin may help to increase fat burning and improve communication between cells in adipose tissues. Findings from preclinical studies suggest that the exposure of mesenteric adipose tissues from obese human to capsaicin likewise increased expression of these proteins. This suggests that capsaicin may have similar anti-inflammatory and metabolic effects in humans as it does in mice. Overall, the research suggests that capsaicin may have the potential anti-inflammatory and metabolic effects in obese mice and humans. Capsaicin can increase the expression of uncoupling protein 2 or UCP2 in endothelial cells, hepatocytes, and cardiac tissue. UCP2 is a mitochondrial protein that helps to regulate energy metabolism. It can protect cells from oxidative stress and promote fat oxidation. In the heart, capsaicin-induced UCP2 expression may help to prevent cardiac hypertrophy and fibrosis. In diabetic mice, capsaicin administration alleviates vascular oxidative stress and improves endothelium-dependent vasodilation. In men with diabetes, a polymorphism in the UCP2 promoter linked to the increased expression of UCP2 in some studies was found to be associated with a significantly lower risk of developing coronary disease. This is consistent with the protective impact of UCP2 expression on cardiovascular risk in diabetes. Hepatocyte expression of UCP2 can be protected in the context of non-alcoholic fatty liver disease. In this syndrome, increased mitochondrial oxidation of fatty acids contributes to the oxidative stress that plays a mediating role. The uncoupling activity of UCP2 decreases this generation of superoxide, and by boosting the rate at which mitochondria can metabolize fatty acids, help to generate the surplus of fatty acids within hepatocytes. Research studies have revealed that capsaicin-mediated induction of UCP2 in hepatocytes may have potential as an adjuvant to weight control strategies which attempt to optimize hunger control, selective fat oxidation, and thermogenesis by improving the efficiency of hepatic fatty acid oxidation. Overall, the research suggests that capsaicin may have potential benefits for cardiovascular health and the prevention of non-alcoholic fatty liver disease. However, more research is needed to confirm these findings and to determine the optimal dose and duration of treatment. To conclude, cayenne pepper is a chili pepper that has been shown to have potential weight loss benefits. It can help to reduce appetite and food cravings, increase metabolism, and burn calories. Capsaicin is the active ingredient in cayenne pepper, which works by activating TRPV1 receptors in the body. These receptors are involved in pain perception, temperature regulation, and appetite control. When capsaicin activates TRPV1 receptors, it sends a signal to the brain that the body is feeling hot. This causes the body to increase its metabolic rate in order to cool down. This can lead to increased fat burning and weight loss. Capsaicin can also help to reduce appetite and food cravings. It does this by increasing the release of hormones that make you feel full, such as leptin and cholecystokinin. In addition, capsaicin can increase the activity of brown adipose tissue, which helps to burn extra calories to generate heat. When brown adipose tissue is activated, it can help to boost metabolism and promote weight loss. Commercial capsules of cayenne pepper are available that provide 40,000 to 100,000 Scoville heat units per capsule. The amount of heat is expressed in Scoville heat units, which represent the number of times the concentration of capsaicinoids need to be diluted before they are no longer detectable. The recommended dose of cayenne pepper for weight loss is 1 to 6 milligrams per day. This can be taken in capsule form or added to food. It is important to note that cayenne pepper can cause side effects such as heartburn, nausea, and diarrhea. If you experience any side effects after taking cayenne pepper, you should not go for it. Overall, the research suggests that cayenne pepper may have potential weight loss benefits due to its ability to suppress appetite, increase satiety, and ameliorate insulin resistance.